Posterior tibialis tendonitis, or pain to the inside of the leg going into the ankle. Maybe you're dealing with it or have had it in the past. In this video, I'm going to teach you why this is happening and how to fix it. What's up guys, Dr. Nick Bonforte. So what is this annoying issue of posterior tibialis tendonitis? First, we have to understand anatomy to better understand what is going on. So this posterior tibialis muscle originates on the lower leg bone, the tibia and the fibula, and it goes down to the inside of the leg to attach to a particular bone in the foot called the navicular bone. Now what this muscle is responsible for doing is pointing the ankle down into what's called plantar flexion and in what's called inversion. So that's the function of what this muscle does for the bottom of the leg. This issue is actually super common, and I see it a lot of the times in a lot of runners. So when you increase a lot of mileage and you have other things going on in the body such as hip strength problems and ankle mobility problems, it tends to lead to this issue brewing up. Now when you have irritation to this particular muscle, the muscle itself could be irritated or the tendons that go down into the foot could be irritated. So if we ignore the pain of this issue and we just continue to train and work out and never really address this issue, it can make the problem worse and it can lead to other issues going on in the body. You might be thinking, well, how do I fix this problem? Let's dive a little bit deeper into some exercises to start addressing this issue. The first up is isometric training to this particular region. So with this one, I'm emphasizing pushing down or gas pedaling down through the ground and actually going into the object I'm using. This is basically putting the two motions that this muscle does, plantar flexion and inversion, like we discussed earlier, into a contraction. And as we isometrically load it, we're working on two things really: reducing pain and improving the loading capacity of this particular region. And when we improve the loading capacity, we're able to take on more force and more load and do more activities without the symptoms sparking up. This exercise is working on the common problem that is limited in the ankle, which is ankle dorsiflexion, which then can lead to some of this issue as posterior tibialis brewing up. So this one, we're working on the ability of the ankle to move into ankle dorsiflexion to ultimately improve this motion to help the ankle from compensating into collapsing too far into pronation, which then contributes to this issue. This exercise is working on the hip stability and the strength on one leg. And now with moving in different directions, it's helped challenging our balance as well at the ankle and foot. So this is isometrically working at the ankle while also working at the hip strength and stability and balance, so then the hip can get strong, and use this as a closed chain exercise to ultimately improve the stability and strength on one leg. So there you go. Those are some exercises you can use to start addressing this issue. Now there's many other progressions, many more exercises that need to be implemented into this, but this is just a start to get the ball rolling at addressing this issue. So there you go. Those are some exercises you can start to address this issue. Now there's other progressions and more things that need to be added to actually get this thing going, but this is just a start to start addressing this issue. Guys, to really help out with the YouTube algorithm, it would be really helpful if you subscribe, like, comment, leave any questions or comments below, turn on your post notifications so you never miss a video. This is Dr. Nick. I'll see you next time.